Greetings to all. I take immense pleasure in sharing about post-abortion care in this video. My name is S. Rukesi. I am working as a tutor in Triple M College of Nursing. Introduction. So, in this video, we are going to see about the post-abortion care. So, post-abortion care is given mainly for the septic abortion. Each year, more than 20 million women undergo an unsafe abortion. Septic abortion is the most common complication to unsafe abortion, and post-abortion care is a procedure to diagnose and manage life-threatening complications to abortion. So, septic abortion is characterized by infection of the products of conception and the uterus. This condition is most commonly a complication of induced or incomplete abortion. Illegal abortions carried out in non-sterile conditions often lead to septic abortions. So, how to diagnose? Before that, we'll quickly review on the causes. The causes of the septic abortions are criminal abortions in which inexpert attempts at termination of pregnancy by passing sticks, catheters, paste, or soap solution into the uterine cavity, and inevitable abortion with infection, and medical termination of pregnancy with infection. So these are the three causes of septic abortion: criminal abortion, inevitable abortion with infection, and medical termination of pregnancy with infection. Next, how to diagnose. For all women of reproductive age, the abdominal pain, fever, or vaginal bleeding. So as it is shown in the picture, you can see the mother can have pain, fever, or vaginal bleeding. Following are the essential parts of initial assessment. So what you will assess: record the last date of the menstrual period. History of family planning. You should ask the mother whether they have been following any methods of family planning like barrier methods or chemical methods, and perform the urine pregnancy test. But remember that women who present late with abortion complications may have negative test. Measure blood pressure, pulse, temperature, perform abdominal examination, and assess for the tenderness of the uterus. So when you do a pervaginal examination, the mother face may show pain, discomfort. So that shows the tenderness of the uterus, and signs of peritonitis such as rebound tenderness. When you put two fingers into the abdomen and when you release, the mother will have the tenderness and a painful feeling. That is called rebound tenderness. That is when you release your finger from the abdomen, that reboundness will cause tenderness to the mother. And size of the abdomen, and where you can also look for whether there is any foul smelling discharge and excessive vaginal bleeding. And so, how to manage septic abortion? If at all a patient presents to you in the OPD with these complaints of septic abortions, how to manage? And septic abortion can be fatal within hours, so it has to be taken very seriously. The septic abortion should be considered as an abscess, and as such it must be treated surgically with evacuation of the remaining products of consumption with no delay. So whatever the treatment process which you follow for the abscess is usually drained. You have to drain the pus. You have to do this incision and drainage, IND procedure for any abscess, and drain out the pus. Only then you will get the healing. So same way, this septic abortion should be considered as an abscess, and as such it must be treated surgically with evacuation of the remaining products of consumption with no delay. If you see the following signs, you have to act immediately. Okay, so if you see in the picture, if you see excessive vaginal bleeding and signs of sepsis such as tender uterus, smelly vaginal discharge, fever, tender lower abdomen. So these are the signs of the sepsis, and signs of shock like blood pressure below 90 mmHg or pulse above 90 beats per minute. So if you see the signs of shock or signs of sepsis or excessive vaginal bleeding, these three symptoms and the signs, you have to act immediately. So how to act immediately? First, you will call for help, assess the airway and ensure the mother is breathing well. If not, you have to establish the airway. Establish intravenous access with the two large bore cannula, 16 or 18, and give fluid resuscitation 2 liters. Because the mother is having excessive vaginal bleeding, you need to replace the fluids. So fluid resuscitation, 2 liters of normal saline or ringer lactate should be infused fast. And so once you do the establish the airway and the fluid, then you can go for the evacuation of the uterus and give antibiotics during or after the procedure. For example, the antibiotics should be ampicillin 2 gram every 6 hours, gentamicin 80 milligrams intravenously every 12 hours, metronidazole 50 milligrams intravenously every 8 hours. Continue antibiotics for 48 hours after the woman is fever free. So if the woman has fever, you need to continue the antibiotics. If the fever is stopped, you can stop the antibiotics after the 48 hours. Okay, after the once the fever subsides, and then after 48 hours we can stop the antibiotics. So antibiotics is are very important during the septic abortions. So do not delay the procedure to avoid antibiotic coverage. Remember, a septic abortion is an abscess that needs surgical treatment with no delay. So because we are giving antibiotic coverage like metronidazole, ampicillin and gentamicin, you should not neglect in doing the surgical procedure. The surgical procedure should be done at once, and as you treat the abscess, this septic abortions also should be treated, and the products of consumption should be emptied. Give ibuprofen, that is Brufen, for pain relief, 400 to 600 milligrams. At peritonitis with the defense, the patient should be prepared for surgery. So if at all we suspect peritonitis, the surgery, so evacuation of the uterus is not enough. Why peritonitis? Means it is already understood that the uterus is perforated and the contents of conceptions has been released into the abdominal cavity, and that will cause peritonitis. So if you see the peritonitis, signs of peritonitis, then the woman should not be treated in the peripheral facilities. She should be transferred to a main hospital, and there they have to do the laparotomy, opening of the abdomen, and draining all the content should be done. If in a peripheral health center facility, start the antibiotic treatment and refer. So stabilize means you have to establish the airway and the fluid, and you have to start with the antibiotic treatment, and along with that immediately you have to refer to do the laparotomy. So evacuation of the uterus. So we are telling about surgical procedures should be done without delay. So what is the surgical procedure? How to evacuate the uterus? Evacuation of the uterus is a life-saving procedure if at a peripheral level without possibility of performing manual vacuum aspiration. Give antibiotics as just stated previously and refer immediately. So if you are at a peripheral level, that is a primary health center, if you can do the manual vacuum aspiration, if you have the syringes and all the equipments, you can carry out. Otherwise, you have to give the antibiotics and refer. This manual vacuum aspiration, MVA, is a preferred method for evacuation of the uterus at a gestational age less than 12 to 14 weeks from last menstrual period. So it states that gestational age should be less than 14 weeks. More than 14 weeks, you cannot do the manual vacuum aspiration because the size of the instrument is will be low, but the contents will be more when you look in for the consumption products more than 14 weeks. So if the products of consumption, the gestational age is less than 14 weeks, you can go for the manual vacuum aspiration. So at the 12 weeks, the uterus is size of a grapefruit. So which, as you can see in the picture, when you palpate at the abdomen, the uterus is the size of a grapefruit and should only be slightly palpable just above the pubic bone. You can just palpate the uterus above the pubic bone at 12 weeks. So that's how you can do it, measure the size of the uterus clinically. And dilatation and curettage can be performed at a higher gestational age up to when the size of the uterus is halfway between umbilicus and the pubic bone. This should only be performed at a referral facility. So DNC is another procedure. MVA is manual vacuum aspiration that you can do when the gestational age is less than 14 weeks. But DNC, that is dilatation and curettage, is another procedure that can be done more than 14 weeks, but not more than 20 weeks. Okay, and clinically, how can you measure the uterus? Means the size of the uterus will be halfway between the umbilicus and the pubic bone. So if the size of the uterus is at that level, you can go in for dilatation and curettage, and that also should be done only at the referral facility, not at a primary health center. So now we'll see about detailing about the manual vacuum aspiration. In the following procedure, the manual vacuum aspiration is demonstrated. So as you can see in the picture, ask for the consent for the procedure and prepare the table with sterile field for cannulas and other instruments. Give analgesia such as diazepam or diclofenac because mother will be very anxious. Okay. Give analgesia such as diazepam or diclofenac or tramadol or brufen and paracervical block. You have to give block as well as analgesia. Among this analgesia, you can prefer any of this analgesia like diazepam or diclofenac or tramadol or brufen. Next, you have to do the paracervical block, right? So how you have to do the paracervical block? Inject 1% of xylocaine 5 milliliters at each at 4 and 8 o'clock position after withdrawing to ensure that needle is not in blood vessel. Wait 2 to 3 minutes for full effect. So as you can see in the picture, you have to give 5 milliliters, 5 ml of the 1% xylocaine and in the paracervical area. So you can inject as you see in the picture, you can see, and then you have to insert the speculum and feel for the lip of the cervix and insert the needle and withdraw for the air to confirm and whether it is not in the blood vessel, then you can inject the xylocaine, and you have to wait for 2 to 3 minutes for full effect. Next, prepare the MVA syringe. Once the anesthesia paracervical block is given, you have to prepare the manual vacuum aspiration syringe by closing the valves. Then, as you see in the picture, insert speculum and clean the vagina. So they have inserted this speculum. This speculum is called the Cusco speculum. Okay, and speculum is inserted and vagina is cleaned with povidone iodine. Insert the tenaculum. So other than the speculum, there's another instrument. If you can see in the picture, the anterior lip has been held by the another instrument in the hand, that is called the tenaculum in the anterior lip of the cervix. Usually the cervix is opened. If it is closed, you have to dilate the cervix according to the numbers. You have to start with the lowest numbers. The tip of the cannula should be sterile and it must not touch the other surface other than the cervix. The so-called no-touch technique should be followed there. And proceed dilating the cervix according to the corresponding gestational weeks. For example, if the gestational weeks is 12 weeks, you have to dilate the cervix up to 12 numbers of the. So if you see in the Hickas dilator, it will be given. See, it has two ends. One end gives one measurement, the other hand gives another measurement. Like if one end shows 3, other end which shows 4. So same way you'll have 5 and 6, 7 and 8. So you have to use it, dilate till 12 numbers comes. Okay. So because the gestational age is 12 weeks. The cannulus is inserted gently until it reaches the fundus of the uterus where a resistance is felt. So don't use force to avoid penetrating the fundus. After dilating the cervix, what you will do? Pull back the cannula 1 centimeter and attach the syringe and apply the suction by opening the valves. So as you can see in the picture, you have to pull back the cannula for 1 centimeter and then you have to attach the syringe in the second picture. And in the third picture, if you can see, you have to once you attach the syringe, you can attach the suction. Then if the products is filled in the syringe, you will have to detach the syringe and push out the aspirate and apply the vacuum again. Okay, and repeat suctioning until you feel a gritty sensation. It means the product is emptied and there is no return of tissue. So this is the procedure. After the procedure, what you have to do? You have to look for the uh, antibiotic coverage. At septic abortion, continue intravenous antibiotics, ampicillin, gentamicin, and metronidazole for 48 hours. After the woman is fever free. Okay. Following give, so that is the first regimen, and IV antibiotics is the first regimen. So that has to be given after the fever settled down. So you have to give for 48 hours and then you can stop. And after the IV antibiotics, you have to start with the oral antibiotics, that is 500 milligrams of ampicillin oral per 6 hours, 500 milligrams of metronidazole oral per 8 hours, and that has to be followed for 5 to 7 days. So what else you have to do? You have to, once the procedure is over and the hemostasis is observed and the patient is comfortable, you have to advise the mother, give the counseling for the mother, and testing for HIV and other sexually transmitted diseases should be part of post-abortion care. And before discharge, you have to also instruct the mother about family planning services to prevent future unwanted pregnancies, and ask the woman to come back if there is persistent pain or excessive bleeding. Okay, so all the discharge advice should be given to the mother before she get discharged. Next. We are going to see about emergency referral. So this is the procedure what we can do at the peripheral level. So emergency referral, how you are supposed to do. First, do not refer if the emergency is not controlled. Never refer a patient with uncontrolled bleeding, unevacuated septic or hemorrhagic abortion or septic abortion. So uncontrolled bleeding, you should not refer the patient, and evacuated uterus, you should not refer the patient. After emergency management, when in a stable condition, discuss decision of referral with women and relatives, quickly organize for referral transport, inform the referral center, accompany the woman. It is crucial that she is accompanied by a health worker who is trained in emergency management if it resurrects during transport. So a health worker accompanying this woman is very important. Consider to bring a relative who can donate. So we are anticipating more loss of blood, so you have to arrange for blood donator. So what all you have to take when you go along with the woman who's been referred to another hospital because of septic abortion? You have to take the emergency drugs, oxytocin, ergometrin for treatment of postpartum hemorrhage, hydrolysine for IV treatment of elevated blood pressure. The hydrolysine will lower the blood pressure, magnesium sulfate for eclampsia, calcium gluconate for intoxication with magnesium sulfate, ampicillin, gentamicin and metronidazole injections, diazepam for pain relief, phenobarbital for the newborn in case of convulsions, adrenaline for newborn in case of cardiac arrest, and supplies. IV equipments and IV fluids, blood pressure monitor, adult ambu bag with appropriate mask sizes, syringes of different size. So during transport, the health worker must do the following, that is, observe the vital signs and level of consciousness. If the woman's condition permits, you can keep the record of all the IV fluids, medications given, time of administration and woman's condition. So these are the things you need to consider while transferring a patient to a referral unit. So till now we have seen about what is post-abortion care, what is the conditions, causes of the what are the causes of the septic abortion. So post abortion care is mainly given for the septic abortion patients, and what are the causes of the septic abortion we have seen, and what are the signs and symptoms of septic abortion, how to diagnose the septic abortion, and how to act in case of emergency, and how to perform the manual vacuum aspiration, what is dilatation and curettage, and how to act in case of emergency, what are the antibiotic coverage. So all these things we have seen. I hope you have gained some knowledge about post abortion care. Thank you.